Hi, Lee Phillips again. I want to talk about keeping patients' airways clear. One of the big problems with ALS in the advanced stages is breathing. And if we can keep the airways clear, that's great. The doctors have given us two types of steroids. One is fluticasone, and we just give her a little spray up her nose twice a day. Once with the fluticasone, 2 sprays up each nostril. And the second one that we do is memetazone. And they're both steroids. This one's a little stronger, a little more expensive. We give her actually this one in the morning and the fluticasone in the evening. In theory, you would only do one once a day, but with Christy, we're doing one of each once a day. And you've got to understand, and you need a doctor who understands, that with an ALS patient, you do what works and what makes them comfortable. We're not worried about things that standard people would deal with. We're not standard people at this point. The other thing we do is we give her a little of N-acetylcysteine. Cysteine is one of the 20 amino acids that you use to build your proteins with, and this has an acetyl group on it, but it maybe undoes some of the swelling or soothes the bronchial. So we give her 1/2 teaspoon, and I've just actually taken a 1/2 teaspoon here, and I paste it on like that, and we put it in one of the syringe bottoms, and then we can pull it out and get that real easy to give her this. This tastes like hell. If you're trying to take this orally, you got a big problem. We didn't start to use it on Christy until she actually had a peg line or a feeding tube, and we'll talk about that in another YouTube. But if it goes directly into the stomach, there's no taste to it, obviously, but this one tastes really bad. So you're not going to give it to them orally. I don't think you can get it in pills, but it's a ton more expensive. You buy a kilo at a time, and we get ours from bulk supplements, some of our chemicals anyway. It's not too bad, and if you only give a 1/2 teaspoon a day, or about 600 milligrams, then it's pretty inexpensive to do that, just a few cents a day. So Lee Phillips talking again on how to keep the bronchioles clear. Oh, by the way, one other thing. Keeping the nasal clear is a problem. Do not use an Afrin or a nose drop because those are extremely addictive. And you end up having to use them every 15 minutes and you just can't clear it after that. And if you stop using them, it's hell for 2 weeks until your body gets used to not having them again. So I would not use a nasal spray as in a nose drop to try and clear the passages in the nasal area. Lee Phillips talking on how to keep the bronchioles clear.